I'm Dr. KOMAL, Assistant Professor KOMAL, Faculty of Ayurvedic Science in JAYOTI University. So today's practical class, we will discuss about fluid therapy. First of all, introduction of fluid therapy. So, intravenous fluids are chemically prepared solutions that are administered to the patient. They are a lot of the body needs and used to replace lost fluid or aid in the delivery of IV medication. In this figure, they all are IV lines. This is exit port, bulb chamber, tubing. Here is the lock and again tube and it's a protective cap. So, for rapid restoration of fluid and electrolytes in the dehydration due to vomiting, diarrhea, shock, due to hemorrhages or sepsis or burn, total parenteral nutrition, anaphylaxis, cardiac arrest, hypoxia, post-gastrointestinal surgeries, or to maintain replacement of loss or as special fluid. So first we talk about advantages and disadvantages. So what is the advantages of fluid therapy? So, provide the patient with life-sustaining fluids, electrolytes and drugs, immediate and predictable therapeutic effects, preferred for administering fluids, electrolytes and drugs in emergency situations, allows fluids intake when a patient has GI malabsorption and permit accurate doses, titrate for analgesics and other drugs. And disadvantages are need hospitalizations and they are costly, infections chances, pyogenic reactions, discomfort, poor patient compliances, food overload changes. Food overload changes. So, electrolytes requirements daily. Sodium iron 50 to 90 millimole per day. Potassium 50 millimole per day required and calcium is 5 millimole per day required. Magnesium iron 1 millimole per IV fluid. The majority of IV solution is sterile water. Chemically, water is referred to as a solvent. A solvent is a substance that dissolves other material called solutes. So within IV solution, the solutes can be molecules called electrolytes or other larger compounds such as protein or molecule. So daily requirement, maintain fluid formula 4 ml per kg per hour for the first 10 kg and 2 ml per kg per hour for the next 10 kg and 1 ml per kg per hour for every kg over 20 kg. Therefore, 70 kg patients using the calculation is 40 plus 20 plus 50 equals to 110 will require 110 ml per hour. Here is fluid electrolyte therapy. Commonly used parenteral fluid. Electrolyte contain millimole per liter. So here is the ESF, calcium, potassium, sodium, potassium, calcium, magnesium, chlorides, bicarbonates, phosphate and energies ratio, and then ringal lactate, 9% salicylic, and then dextrose. So in this index, we showing the figures. Intravenous fluid. IV fluids come in 4 different forms: colloids, crystalloids, and blood. So we talk about fluid therapy. So intravenous fluid is the very important in IV line. So then there are 4 different forms like colloids, crystalloids, blood and blood products. So what is colloid solution? Colloid solution are IV fluids containing large protein and molecules then to stay within the vascular space, blood vessels. They shift the blood from interstitials to intravascular compartment. Colloids are useful in maintaining blood volume. Colloids are expensive, have specific storage requirement, and have a short shelf life. So commonly used colloid solution include plasma protein, fractions, salt poor element, albumin, and extra. So colloid solutions. In this figure, colloids are dextran 14 injection IP. Name is Raleigh-Dextran D. It is the colloid solution. And the crystalloids is, it is in this figure. Like we can elected 500 mg sodium chloride 0.9 mg NS solution 500 ml. So it is crystalloid form and it is colloidal. So that's all about this session. We will talk more about in this fruit therapy session. So that's all about. Thank you.